Doctors of Reddit, what was your "this person is obviously lying, faking" moment? M's here. Had a patient start seizing in front of the cops after they were pulled over for possible drunk driving. We get there and patient is still on and off seizing. We get them on the stretcher and in the back of the ambulance. Surprisingly, the cop joins us. As I take their arm, the shakes start up again. So I tell them, "Yo, if you want this medication, I need you to stop so I can start an IV real quick." Patient stops to let me start the line, and once I say I'm done, they start back up. Patient came in with seizures, non-specific weakness, lightheadedness, and numbness, tingling in her hands and feet. She gets admitted because of some electrolyte issues not related to the neuro symptoms. These were corrected later and symptoms persisted. Sure enough, on the second day she seizes. As soon as the diazepam is pushed before the flush is even in, she stops seizing. This happens again 3 hours later. The third time, while she was seizing, we took her hand and tried to drop it on her face twice. Both times she moved her hand out of the way so it wouldn't smack herself in the face. We just stood there until she got tired of shaking. It took about 5 minutes. She left armor a few hours later. Funniest story of my medical school career. We were rounding on the wards for a teenage son whose parents were in the room. "Dad, we saw our son tested positive for marijuana. This is clearly incorrect." Attending, "There are some false positives but the test is pretty accurate." "Dad, my son is a lifeguard. He would never smoke." "Son, yeah, I've never ever smoked." Looking scared AF. Attending, "We can order a more sensitive test that will give a more accurate answer." "Son, well, I do sit really high up on the lifeguard chair and I think some of the kids around the pool smoke. So maybe I breathed in some of the smoke while working." Team frantically ends conversation to leave the room and laugh hysterically. Patient comes in saying she has terrible abdominal pain, 10 out of 10. I say okay, and start to examine her. She immediately starts screaming the moment I touch her belly. But look, I've seen patients in terrible pain, and nobody has ever yelled in pain with their eyes open. She wasn't even tensing or anything. It was a really sad case though. She has a history of coming in saying she was pregnant when the urine and blood test was clearly negative. In one case she even tried to steal a pregnant patient's urine. She got caught pretty fast. She was on psych follow-up. Not sure what the diagnosis was, but my guess would have been Munchausen's. Anyway, we sent her home without pain meds. My second patient was a man with a chronic cough. Asked him, "Are you smoking?" And he says no. Examines him and there's a cigarette pack right in his breast pocket. An ex of mine told me a story about a dude that had a window wiper handle stuck up his because he had one laying in the shower, slipped and fell onto it. It never occurred to her that it might have not been an accident. I'm an RN. The old "I fell on it" excuse. So, you were walking around your house naked, and fell backwards onto this cucumber that just happened to be sticking straight up off the floor. Well, okay, I have to write down exactly what you tell me. Doc, do you need to refill your meds? Patient, nope, still taking them. I am asking because I know based off of my prescription that it is time for you to get more. If you don't need more, it means you aren't taking them. I brush and floss every day. Every patient at the dentist. Vet student here. Used to work as a technician near a major university as I went through undergrad before getting accepted into vet school. The amount of animals, mainly dogs, who would come in with college students on the weekends after ingesting drugs or alcohol the students left out is higher than I would have expected, but the owners won't tell us the animal got into a drug stash because they don't want to get in trouble, even though we know that's what happened because of the side effects the dog is experiencing. But we need the confirmation from the owner. Just tell us. Making up a story or saying something else happened isn't helping you or your pet, especially in life-threatening situations. In order to properly treat the drug toxicity, we need to know what it is. I promise you, we aren't interested in getting you in trouble, we're interested in saving your pet. Help us do so and be honest when you visit the doc or vet. Had a patient fake a ruptured ectopic pregnancy to get narcotics. Says she was diagnosed with an ectopic at another hospital and given medication to end it. Came into our hospital in extreme abdominal pain, rolling around, yelling, had vaginal bleeding, the whole 9 yards. Gave her a bunch of pain medication so we could get an ultrasound. Ultrasound showed nothing. Urine pregnancy test showed nothing. Beta HCG was 0. Turns out she was conveniently on her period, which made the whole thing very convincing. Got records from the other hospital. Patient had been there yesterday but was not pregnant for them, nor was she diagnosed with an ectopic pregnancy. Definitely was a wow. She just made up this entire thing. We had a lovely conversation about all the results. She ended up screaming at me, threatening to sue me for all I'm worth, and stormed out. Joke's on her, I'm worth $200K of student loan debt. I'm a dentist. We have a drug tracking program shared with any narcotic supplier that tells me what patients have filled out what. I just need their name and DOB. I get drug seekers every now and then with real or fake pain claiming they haven't been taking anything. Quick search shows me the truth. Most people don't know I can do this. I'm a therapist, but I do diagnosing if that counts. I had a woman in my office claiming she had multiple personalities. Is a kinda of a sticky diagnosis to begin with, but that she was claiming that she could talk to different personalities and then bring them out if she needed to. All of this seemed like it could potentially be more of a psychotic disorder or attention seeking. Then she introduced me to her girlfriend who also had multiple personalities, which they started naming, most of which were based on candy or Disney princesses. Notably, the bad one was called the Beast. Edit. I actually asked her if she had seen the movie Split during our session. She said it was a coincidence. Not a doctor, but a hearing aid dispenser in private practice. Had a patient come in for a hearing test. Young guy in his mid-20s, which is already unusual. Main issue is that he's getting noise complaints about his music. No issues with his ears physically. So I do the hearing test, basically ends up with a profound hearing loss. Weird because that's basically sign language territory there. I walk behind him and ask him what his plans are for the evening, to which he responds appropriately. Definitely what we call a non-organic hearing loss. He was trying to get the results he wanted to justify being a bad neighbor. I'm an EMT, if that counts. So here's a good one. About 85% of the calls we receive, at least in my town, are issues where they clearly aren't severely injured. And just think, if I call 911, I'll get into the hospital faster. Pro tip. You still wait like everybody else unless you're actually in serious trouble. Another part of this percentage of people are ones that just want attention, medication. We had a woman recently that decided that she was gonna have a seizure in the ambulance. A real seizure. Put simply, usually looks like they're just tensing up and twitching in one position. This lady was flailing every part of her body everywhere and trying to spit everywhere. Not only was it clearly fake, but we had to clean up the damn mess she made. We'd usually let it slide, but I pulled out a nasal airway and a lube packet and said loudly to my partner, we need to stabilize her breathing. I'll put in the airway in a second. Just let me apply the lube so it doesn't tear open her nose like it usually does. The instant I said it, she stopped having her seizure. Unrelated story, but we also had another woman that claimed she couldn't get up after a fall in her house. We arrived to her entire house being locked, so we called through a window that was cracked to see if there was any other way inside besides breaking through her screen. She proceeds to stand up, go to the front door, unlock the door, walk back to where she was and lay back down. We did a generic checkup and there was clearly nothing wrong. When she said she didn't want to go to the hospital and we were about to leave, she stopped us and asked us to call Comcast for her since we are the M's and are a higher priority. Obligatory, not a doctor post, but when I was a child I remember my doctor asking me about my diet and I, as an overweight unhealthy child, responded with the names of vegetables and fruits that we both knew I didn't eat. I was getting the rundown on a patient once and the nurse said something about back pain and C4. Okay, he has some injury to his neck and it hurts. Nothing special. Then I talked to the guy and nope. He claimed someone had wired the military type of C4 into his back and 1. It hurt. 2. He was afraid it would go boom. It don't know why he thought lying about C4 in his spine would be more believable than saying he was moving a couch or something, but whatever. 3-year-old having tonsil surgery. I run through my usual pre-op evaluation, history, and physical. Parents ensure that she hasn't had anything to eat or drink since the night before. Get her back to the OR. Drift her off to sleep. And when I go to place the breathing tube, she vomits basically solid, completely undigested scrambled eggs and aspirates. Surgery is cancelled. We take her to the ICU. Parents obviously fed her breakfast right before they came in. Confront the parents and they basically say they thought we were just being too mean not letting her eat for 8 hours. There is a reason we ask you not to eat for a period of time before surgery. It is not because we feel like it. Listen to us. Please.